You're listening to The Drive Home.
Alrighty, gang, it's 4:30 on The Drive Home for a Monday. Wayne, Tanya, and Brian all here.
Indeed.
And we are happy to welcome in our friend, Dr. Ryan Jennings, Chief Medical Officer at St. Anthony's Memorial Hospital here in Effingham. Doc, how you been?
Hey, I've been all right. Been a little busy.
Yeah, I bet you have. I bet you have.
So, Doc, obviously, we haven't had you on here in a little bit. Things kind of calmed down, and things are not calming down right now. We've been on a steady ramp up here for a while, haven't we?
Yeah, we sure have, and I think it's hard for people to remember that that on top of COVID, you still got all the normal stuff going on too, and so you still got your pneumonias and your heart failures and your heart attacks and all that kind of stuff, and so it's a busy time to say the least.
Yeah, I mean, flu season and COVID were, obviously destined to mix, unfortunately.
Yeah.
Which makes it hard on everything from nursing homes to schools, right?
Absolutely. So you've all gotten your flu shot, right? That's what you're going to say next, because that is one of the things that we can be doing. We've spent a lot of time being very successful at flattening the curve last go around. By doing those things, by distancing ourselves and things like that. And as we're coming into this holiday, obviously some concern that there'll be a lot of gatherings and those types of things. And boy, you just got to be safe, and you got to be thinking about some of those elderly folks that, you certainly wouldn't want to accidentally expose a family member, because we still see a fair number of folks that really don't have any symptoms, and yet they're carrying the virus.
All right. So that being said, that's an elephant in the room for a whole lot of people. I know that I'm grateful, Dr. Jennings, that every time we've talked to you, you've not taken a political side with this, which is great from a medical standpoint. We love that. What's your advice from somebody local that lives here for folks with Thanksgiving this year?
I really think it is the year to figure out a little different way to do it, especially, again, if you've got an elderly family member or anybody that's in poor health. If you don't not aware of having had the disease already and recovered, because we do think there's some immunity there, then you need to figure out a new way. I get meeting invitations now all the time, and they can't come in the office anymore, and so they send a thing, and they're going to bring you lunch through Grubhub or something like that. So
oh, nice.
They bring you lunch, and then you chat over Zoom or one of those things, so that you still get to interact with those loved ones, but obviously being aware of the possibility of spreading it. And although, like I said, we sure want to be ready for everything, because like you said, with flu ramping up as well, this could be a very, very challenging year. But we also saw serious consequences of people delaying care, and we know that's not the right answer either. So, trying to protect ourselves so you don't end up in a circumstance where you get someone else sick or you get yourself sick is the right first step. And that's still back to the basics, man. That's still hand washing. That's still distancing, the masking, and like I said, add in a flu shot.
Doctor, I do have one question here real quick. We were talking about this off air about our questions today, but I do have one question for you. Over the weekend, I don't know if you saw this, but Elon Musk, obviously a billionaire with a lot more money than either of the four of us, had 4 different COVID tests done. He had the quick PCR, not the PCR test, but he had the quick, antigen test. He had 4 tests done. 2 were positive and 2 were negative.
Huh.
And he does have some symptoms, so he did have COVID. But for people out there who are thinking about, hey, should I get a test? What is the better test? Because this seems to be something I hear from a lot of my friends talk about. Where should I go get tested at? What test should I get? Should I get the test that takes a little bit longer, or should I get the test that comes back basically like a bag of microwave popcorn?
You make it sound so bad. The bag of microwave popcorn. Come on.
Popcorn is delicious and quick.
We all like that.
It's actually fairly complicated. Now, the antigen tests, which are the ones that you're normally talking about that are kind of the quick turnaround tests, work kind of like a strep test in the office or a home pregnancy test, that type of an idea. Turn around very quickly, but they're most accurate early on in the first few days, and you really need to be symptomatic. There's a lot of people that keep going and testing when they don't necessarily have any symptoms. They're just worried about something, and that test is just not very accurate in that world. the PCR testing is the quote gold standard that folks are looking to. But that the rules do move a little bit when you start seeing a lot of it in the community, simply because of the fact that it's more likely that the test is going to be positive to begin with. So when you're looking at Effingham right now, that's 20% or so of people are testing positive. When you're symptomatic, that number's even higher. So that antigen test actually becomes a nice, quick test. But you can't count on the negative. That's really the lesson on the antigen test, is that they're very, very good when they're positive. Yeah. But if it's negative and you're worried that you have it for some reason that you need to know, you got to back that up with a PCR. And actually, the feds and the states just released several hundred of the antigen tests, thousands, really millions by the time you go nationwide. And so there is going to be more testing availability through health departments, hospitals, et cetera, because of the release of all that testing. But again, that's antigen testing. And so, if it's negative, you've got to think twice and really reevaluate the symptoms, talk to your doctor, then make a call on whether or not you need the PCR.
All right.
And the PCR is still a little trickier to find.
Gotcha. Very good.
And you said the PCR, is that the 15-minute or the 48, 72 hour?
That's the one, that most of the time they're being sent out to a lab. Now, we're very lucky in Effingham. We do have some of that, but when we first started talking about this, those supplies are very limited, and so we try to restrict the rapid PCR testing to somebody that, needs to know because they're coming into the hospital, so we have to make plans, or they're going back to a nursing home or some other congregate living environment, and you got to answer the question, Okay. But we'll also see a lot more of the antigen testing. But again, it's a pretty useful test when there's lots of it out there, just because you're going to pick up the positives. But we are lucky. We're starting to see more testing. We've been very lucky as far as our supply of personal protective equipment. We've been very lucky to have a steady supply of remdesivir. Who would have thought that would be in our vocabulary these days? And now then, we're just starting to hear about shipments that'll be forthcoming of the new monoclonal antibody, the bamlanivimab.
Wow. How do you spell that?
Term, by the way.
Yeah. How do you spell that so I can write that? No, I'm kidding.
I'm not even sure. I finally learned how to say remdesivir, and now they came up with something that makes it even harder. So, but really neat to see that stuff coming to fruition and having some definite benefit in people that are sick. And then, of course, on the tails of today, lots of great news around the Moderna vaccine, and of course the Pfizer vaccine.
I heard that
Already on the way. So, and we should see those starting to come into the community over the next few weeks. First line will be healthcare workers. As you look at the public health initiatives around it, they're going to focus on vaccinating healthcare workers, first responders, frontline folks, but then a very large public campaign thereafter. So there seems to be a little bit of sunshine in this mess.
Well, that's great, especially going into the holiday season and flu season as well.
Yeah, it truly is. I mean, we've been through a lot this year, to say the least. And
you ain't kidding.
I just think it's a message of preparedness. It's a message that don't deny yourself health care, because we saw the consequences of that. There are testing capabilities in the community. There's testing behind Building B and all that kind of stuff. So there's some. Although one of the tents made a trip this weekend, I had to catch it and take it apart. But
I bet it was yesterday, wasn't it? For that.
Yeah, that wind got a little wicked there for a little while.
I bet it did.
They're not in Kansas anymore, Dorothy. And then the other thing, that you can really do to help the community is donate blood and the convalescent plasma and that type of things. Of course, with holidays, blood's always an item, but this year more than ever. So being careful, distancing yourself, washing your hands, donating blood, getting the flu shot. Then hopefully, in a few more weeks, we start to see the light at the end of the tunnel with vaccines and those types of things.
Now, just in case, people haven't heard or they haven't been paying attention on where they can go and get a COVID test, what's the easiest place to go to, and how can you do that?
The drive-through testing is probably the easiest. And so, like I said, behind Building B there on Temple Street, Southern Healthcare Foundation as well as the medical group both have drive-through testing facilities on alternating days. I think one of them's on Tuesdays and Thursdays, and the other one's on Monday, Wednesday, and Friday or something. Okay. And that's simple. you access the Med Group one through the portal, through the Epic portal, just like you would for any other lab result. And the Healthcare Foundation one has a phone number you call, and they go through there. There are a few physician offices now that have started to have some antigen testing available. So certainly if you're sick and you need to see your provider, there are some places that are starting to be able to have access to some testing. I mean, it took 6 months, but we're finally starting to see, again, some supplies available. And of course, if you're really sick, you're having chest pain, you're significantly short of breath, you've got underlying medical conditions, those are folks who need to be seen in the emergency department.
Okay,
Right
that sounds
on.
great.
Doctor, I've had actually this question for quite a while, and it's nothing crazy, but it applies, I think, to most people's just everyday life. And I'll see what your take on this is. A lot of people do have to go out and pick up things in the general public at maybe a pharmacy or something. And you go there and, hey, you got to be cautious. So you leave there and you don't want to take any chances. So maybe you get some hand sanitizer on your hands when you get back to your vehicle. Okay. But let's say then you want to take it a step farther and you go back home and you unload your prescriptions and your groceries and you thought, maybe I should disinfect myself again. Here's my question. At that point, what's better? Hand sanitizer or soap and water?
Oh,
Well,
good old soap and water is awfully good stuff.
Uh-huh.
But I'll tell you, the benefit of the hand sanitizer is the quick and the easy application. And so, they both have a role for sure.
Yeah.
And they're both very, very effective. In general, actually, the hand sanitizer wins because it's so convenient, not because it's necessarily more effective.
Okay.
It's just somebody's more likely to touch the top of a little hand dispenser and smear it around as opposed to going to a sink and spending the correct amount of time. You're supposed to be running through your ABCs 3 times there or singing happy birthday, and most folks are not great about that. And they also miss their thumbs, and they miss their thumbs with sanitizer too. They'll rub it into their fingers, but they don't take that moment and grab their thumb with either soap and water or sanitizer. So don't forget your thumbs when you're washing your hands, but both very effective. But as Americans, we are all about convenience. So fortunately, alcohol-based hand sanitizers are extremely effective and kind of win just because we're too lazy to spend time in front of the sink.
hey, plain and simple, that's right.
Very true.
I mean, I will say I'm guilty of that myself because I'll just say, happy birthday, okay, done.
Pick up your chicken there from KFC.
That's right. That's
Yes,
right.
it's true. Yeah.
You got it.
Hey, Brian, did you have anything else?
Nope, good to go.
One
Thanks.
more quick thing, Doctor, and I don't mean to dip into controversial waters here because it is a touchy subject for a lot of folks. But obviously, Governor Pritzker has knocked us back a step here. A lot of restaurants have stayed open with indoor dining. What's your take? I don't want you to wade in and say something that's going to make some folks mad. That's not my goal here. But what's your take on the effectiveness of a face mask? Because that seems to be something that people debate a whole lot online, is that it doesn't do anything or it makes things worse.
Oh, I think the evidence is becoming very clear that it helps. It definitely helps the spread from me to you, but so does distancing, of course. And so, the face mask is making up at some level for a failure to stay away from each other the way that we're being asked to, because, it spreads person to person. But there's starting to be a more emerging evidence that in the healthcare workers, we're seeing fewer people get sick that are in it all the time, presumably because of the face mask actually offering some protection to the wearer, which was not part of the original thought process around masks. But I think the evidence is there. Now, it's not magic. We've seen plenty of folks and lots of healthcare workers, myself included. I ended up with COVID. It was a real party. I recommend it to all my friends. So it's not everything, but those tools, those things like the hand washing, the distancing, the mask, they make a difference. We saw it make a difference when people stopped going out. we flattened the curve. I mean, there is no doubt we flattened the curve, and so now we want to continue to be responsible. And like I said, especially coming into the holidays and being around older folks, immune compromised folks, that type of thing, and the burden that it puts on, of course, just the healthcare system, and of course we manage to that every day. But you know, you add a few more people to the mix, and it makes a challenge.
Very good. As always, delivering just the facts. We appreciate it very much, Doctor.
Yeah.
You do
Appreciate
a wonderful
you having me
job.
on, and maybe we'll chat again before Thanksgiving, and we'll make sure everybody has a safe one.
Yes, I believe we've got you scheduled right before Thanksgiving too.
Do we? All right.
I think
good.
so.
Well, give blood and get a flu shot.
Very good.
All right.
Advice.
Great
All right,
advice as always, Dr. Ryan Jennings. Thanks so much for joining us. Have a great day.
You too. Bye-bye.
There you go. There's Dr. Ryan Jennings, Chief Medical Officer at St. Anthony's Memorial Hospital. We're blessed to have him on the air with us.